name's Lauren. I'm going to be your student nurse today. And I understand you're here for a physical?
Yep.
Okay. Can I get your name and date of birth?
Leanne Harshberger, 06/21/2002.
Perfect. So the physical will take about 30 minutes. It'll include inspection, which is looking, palpating, which is feeling for lumps, tenderness, masses, percussion, which will be tapping, and then auscultation, which will be listening through my stethoscope. Do you have any questions?
Nope.
Okay. So first,
Sorry.
okay. First I'm going to ask you if you have any known allergies specifically to iodine, latex, shellfish.
No.
Okay, and would you consider yourself full code or DNR?
Full code.
Okay. So anything we do here will be kept confidential, and if you have any questions at all, please just let me know.
Okay.
Okay, so first we're gonna look at your physical appearance.
Okay.
So first I would note that patient looks stated age. She is dressed appropriately for the weather. She's well groomed. Her facial expressions appear to be appropriate for the situation. So next I'm going to look at your body structure. So I would note that she appears to be symmetric on both sides. Your posture looks good. You're well nourished. And okay, so next we're gonna, I'm gonna have you walk to the dresser and back.
Okay.
So I would note that you have good range of motion, steady gait. You're able to walk without any noticeable tremors. I don't note any physical deformities that I can notice. And next I would look at your behavior. So I note that you are alert and oriented. You're able to make eye contact while speaking. And your speech appears to be clear and responsive to me. So the next assessment we're going to do is cardiac. So first I'm going to listen to your carotid artery using the bell. So I am able to hear it, and I don't hear any rushing sound, which is normal and expected. So next I'm just going to palpate. And again, I am able to feel your pulse, and I don't feel any rushing sounds or rushing of blood, so that is also expected. So next I'm going to have you lay supine, 30 to 45 degree angle. So I am able to see her jugular venous pulse, and I don't note any heaves, which is also expected. Next, I'm just going to palpate for your apical pulse, which is at the 5th intercostal midclavicular space. Okay, and next I'm just going to place my hand upside down on your chest. Okay, you can sit up. And I don't feel any heaves, which is expected and a normal finding. Okay, so next I'm going to be listening to your heart sounds. So first we're going to start with aortic. So this will be on the right side over here at your second rib. So for that one, S2 should be greater than S1, and I heard that, which is expected. So the next one is pulmonic, which is also at the second intercostal space. Okay, I meant the second rib. So at the second rib, I heard S2 also greater than S1, which is expected. So next is Erb's point, and that one should be equal for both S2A and S1. And this one will be at the third intercostal. Okay, and then at the fourth, so I heard at Erb's point S1 equal to S2, which is expected. Then I went down to the third intercostal space, in which that one should have S1 greater than S2, and then that one would be oh, that one was Erb's point, the third.
Tell Dave we're in the middle of this so then he doesn't come in. I'll go tell him.
Dad, Lauren's in the middle of doing her dad on me, okay? She's in the middle of her dad on me, and Michael's doing it. You get a 5 down.
What? He said, how do you know?
How do you know what?
That he gets a $5 raise per hour for working the next 8 weeks.
Does Colin?
Yep. Everyone.
Dang, that's a good break. Okay, ready? Hi, my name's Lauren. I'm going to be your student nurse today. You're here for a physical?
Yep.
Okay. Can I get your name and date of birth?
Leanne Harshberger, 06/21/2002.
Perfect. And is Leanne your preferred name?
Yep.
Okay. So the physical will take about 30 minutes.
Okay.
It'll include inspection, which would be looking, percussion, which is tapping, palpation, which is feeling, and then auscultating, which is going to be listening with my stethoscope. Do you have any questions at all?
Mm-mm.
Okay, and then do you have any allergies specifically to iodine, latex, shellfish?
Mm-mm.
No? Okay. And then, would you consider yourself full code or DNR?
Full code.
Okay. So everything we do here will be kept confidential. If you have any questions at any time, please just let me know.
Okay.
So first we're going to start with a general assessment. So looking at you, you appear to have appropriate facial expressions. You appear well groomed and dressed appropriately for the weather. You
Sorry.
That's okay. You appear to have good posture and are symmetric on both sides. You appear to be well nourished, and I don't note any noticeable physical deformities to you. I'm going to have you walk to the dresser and back for me. So I would note that your range of motion is good. You have stable gait. You're able to walk stable. I don't note any tremors that occur as you walk. So your behavior, you seem to be alert and orientated. You're able to make eye contact with me when we converse, which is all expected findings. So next we're going to do a cardiac assessment. So first I'm just going to listen to your carotid artery with the bell of a stethoscope. Okay, and I'm able to hear it on both sides, and I don't hear any like rushing noises, which is expected. So next I'm just gonna palpate it. Okay, and I'm able to palpate it on both sides, and again, I don't feel any rushing, which is expected. So next I'm gonna have you lay down at a 30 to 45 degree angle, and then I'm just gonna move your shirt down. So I am able to see your jugular venous pulsate, and I don't note any heaves. So next I'm gonna feel for your apical pulse. So I'm gonna go to your 5th intercostal space, mid-clavicular line. Okay, and I am able to feel it. Next I'm just gonna place my hand on your chest. And you can sit up, and I don't feel any heaves, which is also an expected finding. So next I'm just gonna listen to your lungs or your heart. Okay, so the first one, that was on the right side. That was your aortic. That was at the 2nd rib. That is where S2 should be greater than S1, and I heard that, so that was expected. And then when you go over to the left side, that is your pulmonic. That is also where S2 is greater than S1, and I heard that, so that is expected. Then that was at the 2nd rib. Then you go below that to the 3rd intercostal space. That is where Erb's point is, and that is where S1 and S2 are equal to each other, and I did hear that, so that was expected. And then when you go below that to the 4th intercostal space, I heard the tricuspid valve, and that should be where S1 is greater than S2, which I heard that, so that's also expected. And then below that is the mitral, and that is also where S1 is greater than S2, and I heard that. So everything I heard was in the expected findings. Do you have any questions for me so far?
No, I do not.
Okay, so then the bell of the stethoscope is used because of low-pitched sounds. So for rate and rhythm, irregular rate and rhythm would be if the apical pulse is larger than the radial pulse, and that would be tested at the mitral location where it's in the 5th intercostal space on the left side, where S1 should be greater than S2. Okay, so the next assessment we're going to do is the thoracic and lungs. So I'm just going to have you turn around. That's good. Okay, so I'm just going to expose your back. So first,
What?
so your underwear is showing. So first I'm just going to inspect her posterior back. I would note that her skin tone is pale and even throughout. I note some macules. I note that her vertebral spinous process is straight. Her scapula is even on both sides, which is expected. And her shoulders are also flat and even throughout, which is an also expected finding. So next I'm just going to test her AP, the diameter. So I would note that it is 2 on this side, 2, 1 on the side, which is a normal and also expected finding. Next, I'm just going to palpate your back and just feel around. Let me know if there's any pain. I'm just going to move that up for you. Any pain or tenderness at any location? Okay. And I didn't feel any lumps or masses or anything, which is an expected finding. So next I'm going to do tactile fremitus. So tactile fremitus is where I place my hands like this on your back, and I'm just going to have you say 99 each time I move my hands.
99, 99, 99, 99, 99.
Okay. And each time I moved my hands, the vibrations decreased as I moved down her back, which is expected. So next I'm going to place my hands like this at the bottom of your back, and then I'm going to have you just breathe in and out. So her, my hands move bilaterally, which would indicate her breathing would be equal on both sides, and one side doesn't occur before another side. So next, I'm going to I'm going to feel for C7. So I'm going to have you tuck your neck, and I'm able to palpate it, which is a normal finding. So next, I'm going to feel by your spinous process, your paraspinous muscle. So just let me know if there's any pain or tenderness. Okay. Any pain or tenderness with any of that?
No.
Okay. So next I'm just gonna percuss. So percussion is that tapping, and I'm just gonna tap in the Z pattern.
Okay.
Okay. And so I did hear tympanic sounds, which is a normal and also an expected finding. So next, I'm just gonna listen to your lung sounds.
Okay.
So first, I'm just gonna have you breathe in and out. Okay. So, sorry. I was able to hear all vesicular sounds, which is a normal and expected finding. So next we're going to do your anterior, the front. So I'm going to have you turn around. So next I'm just going to inspect. I would note that your skin is even throughout. I do note some macules, which is an expected finding. I don't note any color deformities, and I don't note that one side is bigger than the other. I'm going to have you take a deep breath in. Okay. And I note that your coastal angle is less than 90 degrees, which is an expected finding. Next, I'm going to just feel palpate across your chest. Let me know if there's any pain. Any pain at all?
Nope.
Okay. So the next thing that I would do, I would percuss, but that would be deferred for this. So next I'm going to listen. So first I'm going to start at your trachea.
Okay.
You take a deep breath in. And then I'm going to go down to your side. Okay. Perfect. So the first one I did was tracheal. That should be a bronchial sound, which is what I heard. The next one is apices, which is right here. That should be a vesicular sound, which is what I heard. The next one is your midclavicular line, which is also vesicular. And then 2 down your sternal border, which would be bronchial vesicular. And in males we do 3, but since breast tissue kind of covers that up, we're going to do 2 for female. And then I did mid-axillary, and that's also bronchial vesicular. Okay, so that finishes our thoracic and lungs. Next, we're gonna do nose, mouth, and throat. So we can cover this up. Sorry. So first, I'm gonna inspect your nose. It appears to be at the midline. I don't know any inflammation. Next, I'm gonna look. I'm gonna have you look up. So I would note that there are fine pale hairs. It's moist inside of there and light pink. So next I'm gonna palpate your frontal and maxillary. So just gonna feel. Any pain or tenderness?
Mm-mm.
Any pain or tenderness?
No.
Okay. So next I'm just going to inspect your mouth and throat. So for this I'm gonna apply hand sanitizer and some gloves. If I can get behind. Okay. Okay, so I'm just gonna have you open your mouth for me. I would note that her buccal mucosa is moist and pink. Her teeth appear to be straight and white. Her gums, they don't appear to be inflamed or any lesions at all, which are all expected findings. So next I'm gonna just look at your sublingual area, which is under your tongue. So I'm just gonna have you stick out put your tongue to the roof of your mouth. So I know that her sublingual area is also light pink. I do note a large vein that runs up her tongue, but that's also an expected finding. So next I'm gonna inspect your soft palate, which is at the roof of your tongue, your soft and hard palate, and then I'm gonna also look at your uvula. So I note that her soft palate is light pink. I note that there's no lesions, which is expected, and I'm gonna have you say ah, and I note that her uvula rises when she says ah, which is an expected finding. Next I would do the gag reflex, but that will be deferred for today. So next I'm going to look at your tonsils. And I know that her tonsils should be rated 2+, which is a normal finding and an expected finding. So that would be it for the nose, mouth, and throat. Do you have any questions? Okay, so next we're going to continue on to lymphatics. I'm just going to... I'm gonna have you expose your arms for me and just hold them out. Okay, so I note that her arms are equal both sides. I do note some macules. I note that they're even in size and shape. Next I'm just gonna feel for the temperature. Okay, so I am able to note that it feels the same temp on both sides. Next, I'm going to palpate bilaterally your brachial and radial pulses. So first, brachial. Okay, radial. So I am able to palpate both her brachial and her radial pulses, which is an expected finding. Next I'm going to check your capillary refill time, so I'm just going to press down. Okay, and then her capillary refill time on both of her fingers were less than 3 seconds, which is a normal and also an expected finding. So next we're going to move to your lower extremities. So I'll just... So I would note even skin tone throughout, pale, they appear to be the same size, even hair distribution throughout. And next I'm just going to feel for the temp. So as I feel bilaterally, I notice that it's even temp throughout. Next, I'm just going to push down to feel for edema, or to test for edema. So it goes back to the normal size, which would be non-pitting because it went back to normal. Okay, so next we're going to, I'm going to palpate each of your pulses. So first we're going to do femoral. That is going to be by your groin area. So I'm just going to have you lay down. And I'm just going to pull your shorts up a little bit. So I am able to feel that pulse, which is expected. I would grade it 2+, which is a normal finding. Next, I'm going to do your popliteal, which is medially back behind your legs. So I'm just going to have you lay in your stomach. Okay, and I'm able to feel both of those pulses, and I would also grade them 2+. Next, I'm going to feel, palpate your anterior tibial pulse, which is back behind your ankle bone. also grade those 2+. I'm going to have you turn back over. The last pulse I'm going to feel for is your dorsalis pedis pulse. So I'm just going to... Okay, so that one's a little more difficult to find, so I'm going to grade that 1+. So that will conclude the lymphatics. One thing I forgot to do on the nose, mouth, and throat, you can sit back up, was test the airflow. So I'm going to have you close one part of your nose and breathe in, and then close the other nasal and breathe in. So that would indicate you have good airflow. But that was supposed to go with the nose, mouth, and throat. So overall, that will conclude all of our assessments today. Everything we found were in the expected and normal limits. Do you have any questions for me?
No.
Okay. Everything will be kept confidential. Once I leave the room, you can change and get back into your normal clothes. And I appreciate you for coming in for your physical.
All right, thanks.